Greetings everybody, I hope you're doing well. Now we're still in lockdown due to the COVID-19 virus, and when we do go out we're practicing something called social distancing. Well, I hope you are anyway. Anyway, this comes just over a century after the last major pandemic ran amok around the world, the Spanish flu, and that got me thinking about how places in the north coped with it. It turns out there was a man in Manchester who was tackling the virus head on, pioneering a proper public health response which included self-isolation and social distancing. Now he's been a bit of a forgotten figure throughout history up until recent weeks when his name has come back into the news, but I still thought it was a good opportunity to look at how one doctor from Aberdeenshire went on to save a city the size of Manchester. By 1918, the world was in the grip of one of the deadliest pandemics in history, an unusually aggressive form of influenza. Now, around a third of the world's population became infected, with around 100 million people eventually dying from it. Its source is still disputed, but the most likely explanation is that it originated on a Kansas farm and was spread to Europe when US troops were sent to fight in the First World War. It became known, however, as the Spanish flu because, unlike other countries such as Britain, France and the US, where news coverage was censored, Spain's media was still free and open. Most of the world heard about how the virus was spreading in Spain and not their own country, and so naturally it adopted its badly fitting name. The pandemic ravaged the front lines of war, its death rate masked by the ongoing carnage in the trenches, but sure enough it made its way to Britain and spread rapidly throughout the densely populated cities. Now in Manchester, the medical officer for health, the guy in charge of the city's healthcare, was a man called James Niven, and it was his job to tackle this dangerous sickness as it spread amongst the city's crowded slums. So Niven was actually born in Aberdeenshire in Scotland, but moved to London to train in medicine. Then he moved to Manchester to set up his private practice before being appointed medical officer for Oldham in 1886. Now while he was in Oldham, Niven became a leading figure in the study of tuberculosis, at the time a disease thought to be spread by bad air, as many were. In fact, it was spread by bacteria, spread by people coughing, sneezing and spitting, and Niven started treating his patients with this in mind. Now working also with patients of smallpox, measles, typhus and whooping cough, all diseases common enough at the time, Niven began to realise two crucial things: that the best way of increasing survival rates was a healthy population in the first place, and the best way to stop infection spreading was cleanliness. But believe it or not, in places like Oldham, Manchester and other working class parts of the country, dirty, grimy and unsanitary conditions were doing just the opposite. So Niven encouraged programs that would improve housing, sewage and rubbish disposal, and they also pressurised authorities to clean up water and air pollution, and also pressurised farmers to at least try to improve the quality of their dirty milk. But when Niven took up the same role in Manchester, the scale of the problem was daunting, but it was the same problem with the same solutions. Now during his 28 years in office in Manchester, the city's population increased by nearly a half, yet the death rate fell by almost a half as well, thanks primarily to Niven's work. For example, a popular way of disposing of human waste at the time was a simple bucket or pail under a seat. Now that had have to be disposed of by hand at regular intervals when the bucket became full. The good old days. Now Niven had 85,000 of these removed from the city's slum houses and replaced by what became known as water closets, where the waste was taken away into the sewage system. He also encouraged the demolition of 23,000 slum houses, which sounds like a bad thing, but these were the worst houses imaginable, totally unsuitable for human habitation. Next, he encouraged the city council to take over Monsall Hospital, a fever hospital where highly infectious patients could be isolated from other sick people. When the first wave of the flu pandemic hit the slums of Manchester in 1918, Niven quickly saw how unusually aggressive it was. He urged authorities to take action to halt its spread and to warn the public about its dangers. A decisive public health campaign might slow the rate at which it spread through the population. Now, despite experts like Niven ringing the alarm bells, the national government in Westminster weren't so keen to act. The virus was downplayed and even ignored. In fact, it was only considered a national security threat in terms of the effect it could have on wartime morale. If the public began worrying about a disease, the government thought, then support for the war effort would be shaken. A war by this point which had cost hundreds of thousands of lives and gained hardly any ground. They wanted life to go on, businesses to stay open, and they were only really worried about the health of the economy. In fact, Sir Arthur Newsom, a senior health advisor to the government at the time, even suggested they do nothing at all. Take it on the chin, stiff upper lip, blah blah blah. Does it sound familiar?
Nationally, little was done and feet were dragged, and when a second more deadly wave of the virus struck the world in the autumn of that year, Britain suffered far more than it should have. Not only was the second wave highly infectious, but it was also very deadly, killing those who caught it within days in some cases. Incredibly, in September 1918, Prime Minister David Lloyd George visited Manchester, and Mancunians gathered in their thousands to see him. A short time later, he was struck down with symptoms of the virus and confined to a room in the town hall for 10 days. Niven continued to fight the infection in Manchester, however, discouraging people from gathering in numbers and keeping an unusually large distance from each other, what today we lovingly call social distancing. He encouraged the closure of schools, the banning of public events, and distributed around 35,000 leaflets around the city urging people to reduce their risks, and staying at home in isolation if they thought they'd become infected. Finally, Niven organised the provision of free food and baby milk powder for those vulnerable to starvation during the measures, the very basics of a rudimentary welfare state.
Now, by the autumn of 1918, over 100,000 Mancunians are thought to have contracted the virus, yet only 322 actually had died from it. Now, this was incredibly low compared to other areas, and it looked like Dr. Niven's preventative measures had saved hundreds, if not thousands, of lives. Now, Dr. James Niven suffered from deep depression, which sadly got the better of him after retirement, and sadly he killed himself in September of 1925. So there you go, Dr. James Niven, a highly educated man whose expertise and compassion saved Manchester from the worst of the 1918 pandemic. But his public health measures also transformed the city in the long term, emphasising the glaring poverty suffered by Manchester's poorest inhabitants. Hey guys, so this is the first of a series of short videos I'll be doing about Northerners, people from the north of Britain who made their mark on history, for better or for worse. And now I'm fully aware that Dr. James Niven is actually from Scotland, but for the purpose of this series I'll be looking at anybody in the top half of Britain, so anyone north of the Midlands. So anyway, thanks for watching. I hope you catch the next one. Please like and subscribe and blah 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 blah. Thanks for watching. Stay classy.